So today we're going to talk about the best vitamin for sciatica. Now, what is sciatica? Sciatica is pain down the sciatic nerve. Now, the sciatic nerve comes from your lumbar spine all the way in the back part of your leg, all the way down into the bottom of your foot. It's the longest nerve in the body. It's the widest, biggest nerve in the body. And it can create a lot of pain and misery, especially if you are in a situation where you have to drive long periods of time or you're sitting a lot behind your desk. So the sciatic nerve needs certain nutrients to function correctly. But the deficiency that will create the most damage on that nerve is a vitamin B2 deficiency called riboflavin. Now, you can also get sciatica from other deficiencies as well, especially B12 and B1, so I would recommend taking the whole B complex just to be sure. And I'd probably take benfotiamine, which is a fat soluble B1 that's been studied. It's very helpful in peripheral neuropathy, pain in the bottom of the foot. So I also wanted to talk about additional symptoms that can occur if you're low in vitamin B2. So we talked about peripheral neuropathy, that's nerve damage in the peripheral, which means it refers down into either the arm or the leg. The limbs are weak, skin lesions or skin problems, swollen mouth or tongue or red tongue, breakdown of the nervous system. About the myelin sheath, the outer part of that nerve, which is related to this right here, a cracked heel. So the back part of your heels, if it's dry and cracking, that's a B2 deficiency. Oily skin, particularly around the nose. And even hearing loss, now a B2 deficiency could be created because you're just not consuming the foods that are high in B2. Or, more commonly, you have a problem with your gut, whether you have gut damage, celiac disease, Crohn's disease, diverticulitis, or some type of malabsorption in your small or large intestine. Let's say you took a bunch of antibiotics one time, and that destroyed your ability to absorb nutrients. That could explain your B2 deficiency, in which case you simply need to take a lot more B2 to get the absorption. The foods that are high in B2 are liver, beef, clams and other shellfish, mushrooms, nuts, cheese, eggs, fish and even green vegetables. However, it's important to note that vitamin B should not be used as a sole treatment for lower back pain and sciatica. It should always be combined with other treatments such as physical therapy, exercise, and over-the-counter pain medication. Additionally, it is always best to consult with a healthcare professional before starting any new treatment. So check them out and comment down below.